Over there? Yes. Okay, let me know if I need to talk louder. So tonight I'm going to talk about one of my favorite topics, which is what? All right, are we ready now? You okay? So, okay, so if you were here at the first talk, Leila did an excellent job, so I'm going to try and at least match that. I'm talking about hormones, which is one of my favorite topics because hormones are usually the reason why women do the crazy things that we do, right? So why are my hormones making me crazy? Causes of chaos. This is me. This is all my information. I do telehealth, functional medicine, chiropractic care. Our office, our family, all our patients become part of the family. So if you're not already in our practice, then I hope that you will join us, come down and hang with us. And I really, when I approach patients and when I start to learn things, I think that education and preparation are really the key. When we're not educated, we're not prepared, everything hits us like a tornado, right? But if you have that preparation and you know what's coming or what potentially could be coming, then everything is a lot more calm and you can weather the storm or prevent the storm. So hormones. So the major players, we have our estrogen, right? 3 kinds of estrogen, E1, E2, E3. We have progesterone. Progesterone helps to kind of calm the brain. It helps to sustain pregnancy. It does a lot of other things. Testosterone. Testosterone is the brute strength. Testosterone is our drive. Both men and women have testosterone. Men just have more. DHEA. DHEA is a precursor for testosterone for estrogen. It's very important to balance things out. LH and FSH, these are 2 hormones that help us with ovulation. So FSH and LH spike in the middle of the cycle, and that's what causes our ovaries to ovulate. These are also 2 hormones that we watch very closely when we're getting into perimenopause or menopause, because when the ovaries stop listening, these are the 2 hormones that start screaming really loud. Okay, so this is a good key indicator if these start to rise. Prolactin helps with breast development. It also helps to sustain breastfeeding. And then I don't know why those 2 pop up at the same time, but thyroid hormone, we all know that that is like our metabolic regulator. And melatonin helps us with sleep. Melatonin also converts back and forth with serotonin, which is our happy hormone. And melatonin also, they're finding, is very important for neurologic development and neurocognitive health. So as far as Alzheimer's and Parkinson's, melatonin is playing a lot of, a larger role in all of the treatment for those. So what does a normal cycle look like? So the cycle has 2 parts. We have the first part, which is the follicular phase, usually from day 1 to day 14-ish. And then the second part is the luteal phase, which is day 15 to about 30. And everybody's cycle is different. This is an average. Some women will have a shorter cycle. Some women have longer cycles. When we get into perimenopause and menopause, of course, menopause, the cycle stops. Once the cycle has stopped for 12 consecutive months, you're considered in menopause. There is no post-menopause. Menopause is the end of the road, right? So that perimenopausal period, you may have a period once, you may have another one in four months, you may have another one 2 weeks after that. So you're going to have a lot of fluctuations. Periods may get heavier. So there's a lot of changes that happen during that period. So if you can see too, the estrogen and the progesterone. Estrogen is more predominant in the first part of the cycle. Progesterone, once we ovulate, that part of the ovulation, the ovary, kind of folds in on itself. That becomes the corpus luteum, and that's where we get our progesterone from. Okay, if there's no implantation, then we cycle back around and then we bleed and we go through another cycle. So we really have 2 periods of chaos, right? And those of us that have daughters, we know about that. So during our puberty years, there's a lot of hormone fluctuation, right? A lot of development. Estrogen fluctuates, progesterone fluctuates, prolactin, all of those things. So we're very moody. And then right about the time when our daughters are teenagers, we start fluctuating again. So it's kind of like a double whammy. So then we get estrogen starts to wax and wane. Progesterone may or may not wax or wane. If it goes, it may just decline. But it's important to realize that those are really the 2 parts of our lives. In an ideal situation, the hormones would turn on, we would menstruate, and then when we're done, hormones would turn off, and it would be really smooth sailing, and we'd have no complaints. Never happens that way. So this is really, when we talk about the steroid hormones, which is all of our hormones basically, they all come from cholesterol. So when you go to the doctor and they do blood work and your cholesterol is a couple points high, what's the first thing they do? They put us on drugs to lower the cholesterol. And I think it's important that we recognize that not only vitamin D, which is helpful for our bone health, our immune health, our gut health, comes from cholesterol, but also we have progesterone from cholesterol. We have DHEA from cholesterol, which then goes down to form testosterone. Testosterone gets converted to our E1, E2, and E3. And then finally, cortisol. So cortisol is our stress hormone, right? Cortisol is what we need when the tiger walks in the room and we need to run. And cortisol is very helpful to us if it's an acute situation. And then once that situation is done, it resolves, and then we go back to life as normal. Unfortunately, what's happened now is we're so goddamn busy and we're chronically stressed and we're trying to do too many things that cortisol continues to be turned on, which causes more inflammation in the long run. So it causes more inflammation, which triggers higher weight gain. It also, if there's chronic stress and the body needs more cortisol, it's going to draw that from somewhere. So it usually will draw that from pregnenolone, which then limits the amount of progesterone and other hormones. So we call that pregnenolone steal. And people that are estrogen dominant, which I'll talk about in a little while, it's often because they're super stressed. And then so there's more estrogen in relation to prednisone because it's being taken up by making more cortisol. And so thinking used to be that the brain would talk to the ovaries, which would talk to the brain, which would talk to the ovaries. But we know now that there's different axes in the body. So we have a hypothalamus pituitary ovary axis, the gonads. We have an axis with the brain and the gut. We have an axis with the thyroid and the brain. We also have an adrenal brain axis. So in actuality, it kind of looks like this. So you can see when something goes wrong somewhere, it really goes wrong everywhere. Yes. And then if you throw in something like insulin or blood sugar dysfunction, or you throw in inflammation, then you can see how the brain, the ovaries, the gut, they're all going to talk to one another. And if you are not able to detox properly, then the liver jumps in there. Okay, so it really is a lot more complicated than they thought. And there's a complex connection between the endocrine system, the neurologic system or the brain, and the immune system. So you can see if any one of those things is off, that triangle is sent off of its axis. And when that's sent off, it kind of makes things go awry. Stress is a big player in all of this. So stress can interrupt that triangle. Stress inhibits thyroid function. It activates our fight or flight, which is going to activate the cortisol, which is then going to draw some of the hormones away. It causes immune dysfunction, so it changes the way our immune system works. It changes the microbiota in your gut, right? So we learned about that last time. And that microbiota, as you'll see, affects your ability to detox. It affects your ability to digest food. It affects how you feel, your inflammation levels. So decrease in progesterone because of the increase in the stress and the cortisol, and then it also affects your sleep. So just one little shift like that can make a really big difference. This is my smoking hot body. And so when we talk about hormone dysfunction, there's different patterns that we look at. And tonight I'm really going to focus on estrogen dominance, fluctuating hormone levels, and hormone insufficiency, because those are for perimenopausal and menopausal women. But things like suboptimal hormones, so enzymes, diet, stress, adiposity, that can affect anybody at any age, really. Luteal phase dysfunction is really low progesterone, so the ability to get pregnant or maintain a pregnancy. But I'm going to talk a little bit more about the estrogen dominance, which can be due to genetics, aromatase, obesity, inflammation, metabolism changes, stress, inability to detox, all of those things. And then fluctuating hormone levels, one, because you're in menopause or perimenopause, two, because you have PMS, which could be due to a whole bunch of different things, PMDD, or hormone insufficiency. So as we age, a lot of things decline. So that's why we have to try harder. We need more good vegetables. We need more exercise. We need more brain food. Natural levels of different things like DHEA and estrogen and progesterone and all of those things decline naturally. And then premature ovarian failure, if you have a hysterectomy, that obviously is going to send you into menopause earlier than normally would. So estrogen dominance, there's a couple of different reasons, and that could be not so much that estrogen is high. Estrogen levels and progesterone levels can be normal, but in relation to progesterone, the estrogen levels are going to be higher. And so that may be due to obesity. Obesity produces what's called aromatase, which is an enzyme that converts testosterone to estrogen. So that's why weight gain is not very healthy for us. Inflammation also. Inflammation can stimulate the conversion of aromatase to testosterone to estrogen. Metabolic changes in your estrogen production, or stress, which again is that cortisol steal. So that's going to lower progesterone, which makes estrogen look higher. So estrogen dominance is, you think, oh my God, it's going to be sky high, but it doesn't necessarily have to be. And the trouble is that when you go to your gynecologist and they take blood work and they look at it, they go, oh, everything's normal. But is it the high end of normal? Is it normal for your age? Is it normal ratios? So you really have to look a little bit deeper than just your average gynecologist who thinks you're crazy and says, oh, it's normal. Oh, this is normal. You're not sleeping, you're cranky, you're gaining weight, your cholesterol's off, it's all normal. So estrogen fluctuations. So when estrogen starts to wax and wane, a couple things happen. One is one of the inflammatory cells that kind of floats around is this IL-6. And that marker causes inflammation. It changes the way molecules signal one another. It also wreaks a lot of havoc. That's like the main inflammatory molecule that causes all of the changes that come with menopause and estrogen deficiency. It also is a big player in bone loss. So when we think of, you get this automatic spike when we go into menopause of IL-6, causes all of these physiologic changes in the body, and then it also sets the stage for bone loss. So where do you think we store all the toxins that we've accumulated over our lifetime? We store them in fat tissue, we store them in bone tissue. So that's why a lot of women, when they start being osteoporotic or osteopenic, they're losing bone, but all of those toxins are then liberated. So we really depend on the liver to be able to bind those toxins and get them out of our body. Along with that, glutathione, antioxidants. So these also will help to make sure that the liver and the gallbladder emulsifies the fats, the liver does the detox, dumps it into the intestines. So all those toxins we either have to poop out, we pee out, or we sweat it out. So that's just another reason why exercise is important. Prostaglandins, so these are our inflammatory markers. And when we have inflammation, the adipose tissue produces its own prostaglandins, and they're produced by these COX-1 and COX-2 mechanisms. And when we take Advil or we take Tylenol, that's what gets shut down, is those COX-1 and 2. That's why the headache goes away, the aches and pains go away for a little while. But the body doesn't just stop making those. When you're inflamed in your body, you're also inflamed in your brain. So we do have a gut barrier, we also have a blood-brain barrier in the brain. So if you're having intestinal issues, leaky gut, chances are that your blood-brain barrier also is weak and has holes in it. So we get inflammation in the brain, we get foggy brain, right? We get slowed thinking. Walk into a closet, you don't remember why you walked in there. Memory issues, memory with recall. So some people can remember faces, they can't remember names. I've never been good at names, but faces I remember so well. It also can affect your anger management, so we get a little bit shorter fused. And then there's a new model of depression that is really neurologic based. So it's a neuroinflammatory model of depression where the inflammation actually causes the signals to transmit down those nerve fibers slower. So things are going slower, you're feeling slower, and you get more depressed from that inflammation. Leaky gut, I just talked about. So food sensitivities, heartburn, gas, bloating. I know Leila, your daughter, had a lot of issues.
Yes.
And then nitric oxide. So nitric oxide really is the chemical that our body makes that helps to control our blood pressure. So the lining of the vessels. So it's common as we age, the vessels get a little more stiff, we're not as pliable, and so pressure may go up. Nitric oxide plays a big role in that. If there's less blood flow, we get colder hands when we're older, you get colder feet, and also blood flow to the scalp, so we tend to lose hair because the blood flow to the scalp. So scalp massages, that's why they're the best. So when we don't have enough estrogen, what happens? What are the symptoms? There's a lot of them, right? So acne. And a lot of these pertain to teenagers too, right? Hormone fluctuations. So anxiety, arthritis, bladder issues, brittle hair, fatigue, decreased. And I think I was appetizing and then I didn't. That's my ADD talking. So memory, foggy brain, immune dysfunction, thinning hair, bone density issues, blood pressure, elevated cholesterol. Why? Because we don't have enough hormones. So our body is not making a mistake. The body is not dumb. A lot of these things are done on purpose. We get more headaches, decreased libido, weight gain, cardiovascular changes. We don't sleep as well. So how many people here are up at like 3, 4 in the morning? Yep. Blood sugar balancing gets more difficult, vaginal dryness, loss of tone. Things are not as tight as they once were. We get a little mushy. And then changes with our skin. Our skin's not as tight, right? The cheeks, that's why we need Botox and all sorts of things like that. And bad hair days. So we all had gorgeous hair when we were teenagers. And the reason that when we get older is because there's 4 phases of hair growth. I thought this was really interesting. So there's a reduction in hair growth when we lose that estrogen. There's also the resting phase. Usually we go into a resting phase before we lose hair. That resting phase gets really short. So you're not growing as much hair, but you're also not holding on to hair as long. And then you're losing it more than you're growing it. So we tend to lose the hair here. So when you look in the mirror, all you see is that it's thinner. But it's different than the male pattern baldness. That's due to something else. That's due to DHT. Yeah. Well, if there's a problem with testosterone, you can produce something called DHT, which is more androgenic than even testosterone. And that can cause you to grow more facial hair, mustache, so that. And then when you have a lot of that, then you can get male pattern baldness in a female. So detoxification is also really super important. So you detox mostly in the liver, but we also detox in our gut, our brain, our kidneys, and some in breast tissue. And detoxification involves really 2 phases, really 3. But the first phase, most of the compounds in our body are fat soluble, right? Because our membranes have a fat soluble layer on the outside. So the first phase is really to use enzymes to make those compounds they turn them into an active intermediate, right? Then the next phase turns them into a water-soluble compound by conjugation. So it attaches something that makes them water-soluble. And then we either pee them out, we sweat them out, or it gets dumped into our intestines and we poop it out. So if there's a problem in phase 1, And you can do phase 1, but phase 2 is blocked. You end up with a lot of these active intermediates that cause DNA damage. They cause oxidative stress. So basically, they can damage your tissues. So that's why it's important. I ask every single patient, how many times do you poop? I talk way more about poop than I ever should. But if you're not pooping, then you can get stuck in these intermediate phases, right? And microbiome also plays a big role in this, because if you have dysbiosis, everything that's conjugated will get unconjugated by the time the bacteria is done with it, and then all those hormones that you're trying to get rid of get reabsorbed back up into your intestines and back into your system. So that's another pathway to be estrogen dominant.
That's why they say that gut is your second brain.
Exactly,
Right.
exactly. So the moral of the story really is you gotta poop. Everybody poops.
How often?
Once or twice a day. Yeah, especially if you're doing like a detox program and you're not pooping every day, then you probably won't feel very well, because especially if you have dysbiosis and those bacteria are working overtime and they're unconjugating everything that your liver's trying to do, and you get all these reactive oxygen species and stuff like that.
The shape, right? The shape of the poop is important.
Well, yeah, I mean, you know, you want to make sure it's long, brown, banana shaped, shouldn't be too pebbly, shouldn't be too loose, it shouldn't float, shouldn't have whole food in your poop, so that kind of thing. So when we go to the doctor, standard medical care, and we look like this, right? So what does standard medical care do for us? It does this, right? It spray paints us. They give us drugs. They give us medications. And they say, everything's fine. Take this. We'll raise your cholesterol. We'll lower your cholesterol. We're going to do all these things for you. But there's another option. So functional medicine uses this tree. And on the top of the tree, these are really the diagnoses. So when we're entering, oh, the cursor doesn't show up there. When we enter, we're entering like right in the middle of that tree. That's your signs and symptoms. So that's what brings you to the doctor's office, right? So typically they'll say, okay, we'll do your blood work. This is out of whack, we'll give you this. This is out of whack, we'll give you this. You have a bellyache, we'll give you this, right? Functional medicine looks a little bit deeper, and we look more at the fundamentals. So we look at 7 nodes. Let me go back. So we look at assimilation. We look at how your GI tract is working. We look at structural integrity. Are your cells intact? You know, what does your structure look like? Do you have acne? Are there things going on there? Communication. This is your endocrine system. So are the signals getting to where they need to get to? Are we able to, do we have the right nutrients in order to make the hormones? We look at biotransformation. This is our ability to detox. We look at energy. This is the mitochondria itself, which produces the ATP, which really is the currency to get the whole body moving. So we look at that. We look at, sorry guys, defense and repair. So we look at how well the immune system's working and how well we're able to get rid of bad guys if we need to. And then at the bottom, we look at transport. So this is really your blood system transporting all your immune molecules and your lymphatic system. And then, of course, we also look at antecedents, which is like genetic SNPs. This is your prenatal exposures. This is how your mom felt. What was your mom's toxic load when she was pregnant with you? Right? So all of those things are important because that gets transported down in the chain. And then we look at your diet. We look at the mitigating factors. So we look at if there was any antibiotic use, if there was any exposures, if there was any abuse in your history. That's going to affect the way your brain works. That affects how your biochemistry works. We look at whether there's any mediators. Is there anything going on that's going to prevent you from getting well, or is kind of perpetuating the illness that you have? So nutrient deficiencies. Are you overweight? Is there any stress in your life? Do you have any old illnesses or infections, a tick bite or COVID, something like that that's going to make it difficult for you to get past that? And then also, always important is your sleep, your self-care. Are you taking care of yourself? What does your diet look like? Do you have the sad American diet or the horrible American diet? And then community and culture, right? And in the center of this, we have mental, emotional, and spiritual, which really takes our experience, our attitudes, and our beliefs. And all of that is just so important. So when a patient comes in to see me for functional medicine, their whole functional medicine matrix is different. So depending on what your history looks like, the nodes of the matrix are going to be filled in differently. Your antecedents, your triggers, and your mediators are going to be different. And then the things that you're doing or not doing on that bottom row there for yourself, some people do them, some people don't. We also have to look at PTSD. So production, are we able to produce the hormones, right? Because if you don't have the right nutrients, you can't bake the cake. Are we able to transport them? So do we have the right transporters, which would be like albumin or sex hormone binding globulin? Are the cells, once it gets to where it needs to go, are the cells sensitive enough to bind and make the changes they need to make? Or are there endocrine disrupting chemicals that look the same as hormones and they've already bound there? So that's going to be your phthalates, glyphosates, they look like hormones, and so they bind the cells, and then when the hormones get there, they can't do their job because there's nowhere for them to park. And then also detoxification, which I talked about. We need to be able to get rid of the old hormones. The body needs to get rid of the trash. So this is a test. This is a urine test called the Dutch test, and I love it. Are you familiar with this test? So it's a dried urine test for hormones. And it looks at your androgens, it looks at your estrogens, it looks at your progesterone, the urinary metabolics. It looks at the breakdown, so it looks at how well you're able to detox. It looks at the different forms of estrogen that you're detoxing, whether you have a good, healthy pathway or you have a more destructive, cancer-causing pathway, the balance of the 3 estrogens that you have. I only put one page, but this also looks at your adrenal glands, so it looks at your cortisol levels throughout the day. It looks at active versus inactive cortisol. It looks at your B vitamins. It looks at your gut health. It looks at your neurotransmitters. It looks at your overall oxidative stress levels, melatonin. So it gives you a really good overall picture of what you're doing. This is a urine test. You do it at home. Yeah, you pee on a stick 4 times, and it's a wonderful test. We get so much information out of this test, and there's no blood draw. So even teenagers will do it.
I have a lot of friends doing it.
Yeah, it's a really great test. And so how can we make all this better? So we can work on decreasing inflammation, fix the gut, reduce the stress, balance blood sugars, all of this stuff we all know. Support your brain health. Exercise is a big one. Even if we go out and we walk 15, 20 minutes a day, just exercising, and then using supplements. So I always take a food first approach, and if you can get your nutrients through food, all the better. So the most nutrient dense foods, of course, are your greens, your collards, your green, your kale, all of those are the most nutrient dense. And so try and eat a couple servings of those. But also you want to eat the rainbow. So you want to eat your reds and your yellows and your oranges, your blues, your purples. All of that is really crucial. Controlling inflammation. So inflammation really comes from a couple of places. So foods, bugs, toxins, stress, hormones that we're not able to detoxify, and then adiposity. So one of the biggest problems in this country now is that more and more people are overweight. You know, we're not eating as well, we're not exercising as much, we're more stressed than we should be. And so adiposity, it's amazing. These little fat cells can produce their own hormones, they produce their own pain mediators, you know, so they really can wreak havoc. So that's why these GLP-1 drugs, they can be helpful. I don't think anyone should be on them long term, but if you need a boost to start to lose weight, I think you need to start somewhere. So in that case, I think that they can be helpful.
Is it possible that, like, if you resolve some of the other hormonal issues, that you'll be able to lose weight
Yes.
easier?
Yes. Yeah. If the body can't get rid of toxins, it's not dumb. It's going to store them somewhere so that you can still live your life, right? But if you make that process easier and you don't have to store them anywhere, then the body's going to be more agreeable to lose the weight. But there has to be the exercise part of it. There has to be the stress part of it. So we can look at things like intermittent fasting helps for some people, not everybody. Eating well, the Dirty Dozen, the Clean 15. phytoestrogens, so we don't want to eat too much soy. Soy also is loaded with pesticides. We want to make sure that we're not eating things that are going to bind those estrogen receptors. Blood sugar balancing, good fats, eat our cruciferous vegetables because they help us detox. And then one of the things that I do is I put people on food plans. I hate calling them diets, but eliminating diets helps to reduce inflammation if any of those foods are causing you inflammation with leaky gut. A detoxification diet, mitochondrial diet, or cardiometabolic, and each of these diets focus on either more energy for the body, reducing inflammation, blood sugar balancing, so helping the body detox. So each diet is really focused on correcting all of these mechanisms. Oh, where did that other one not go? So here's our clean 15 and our dirty dozen, right? So this changes every year. Basically, if the food that you're going to eat needs to be peeled or sliced, or it has an outside on it, or it doesn't have a lot of cracks and crevices, that's a food that doesn't need to be organic. Always buy organic if you can.
Do we know the percentage or the density of toxins in these dirty ones?
I think it depends on where you get them.
It's where it's grown.
Yeah,
How
yeah,
long does it take to get here? What do they have to apply to it for it to last?
yeah,
There's a lot.
yeah.
involved in that.
So if it's on a boat and then it's on a train and then it has to be transported, and these also, once you pick a food, it loses nutrients from the second it comes off the tree. It starts to lose nutrients. So you want to get it. That's why sourcing close to home, and New Jersey has great soil. So, but even in New Jersey, the soil is getting depleted. So not only are they dirty because of pesticides, so you have to clean them, but they also don't have the same nutrients that they had when our parents grew the stuff in the backyard. So if I had to pick 4, so a lot of patients, they can't afford to be on 20 different supplements all the time. So a vitamin and a mineral, a good multivitamin, a good multi-mineral. Omegas help with brain. Omegas help with inflammation. They also help with the cells. So at the outside of your cells are fat. Vitamin D, because of all the benefits for the immune system, the bones, and your stomach. And then pre and probiotics, because those are the good guys. They help with so many different functions. And when we think of how many cells in our body, there's like 10 times more bacteria than we have cells in our body.
Do you have any recommendations for those 4?
I carry in the office. I carry like Designs for Health. They have like a good primal multi. Orthomolecular has a good mito vitamin. So nowadays you can get vitamins that are really stocked with stuff, really good quality vitamins. If you get vitamins, you want them to be methylated. So you want to try and get really good quality vitamins that your body doesn't have to do a lot to. So if you've got to convert it and then convert it and then convert it and then hope that you absorb it, chances are you're not getting a whole lot. Those are going to be more very inexpensive vitamins. So one thing I would say is call me if there's anything that you have in mind, and I can go over some different options for you. All right?
I think just making sure that there's not a lot of fillers, right?
Yeah, you want non-GMO, you want stuff that's, gluten-free, soy-free, dairy-free. You just want a good quality vitamin.
And make sure you drink a lot of water when you take them.
Yeah, lots of water.
Yes.
Yeah.
Do you have a preference, liquid over pills?
Whatever is going to get them into you.
Okay.
Yeah, really. Omegas, I've tried liquid omegas. They taste terrible. So definitely do those in a gel cap. Pre and probiotics, now there's so many different options. If you can get one that is a combined pre and probiotic, there are some now that come with the probiotic in the middle, encased in a prebiotic. Prebiotic is basically the food for the probiotics. So you might as well send them in with lunch, right? Yep. Vitamin Ds, you want a good vitamin D with K unless you have a clotting issue. If you have a clotting issue or a genetic defect in clotting, then you don't want the K part. And vitamin D you always want to take with a fatty meal with food because it's a fat-soluble vitamin.
What about for
So iron deficiency is interesting because when you go to the doctor, they give you iron, right? But what if the deficiency is not iron? What if it's that you don't have B vitamins? You need B vitamins to make heme, to make a red blood cell that's going to carry your iron, right? So you can have lots of iron and your ferritin levels can be high, but you could still be anemic. So it really is, the one I use is Hemavite, and it has all the ingredients in there. And you also take it, it has a little bit of vitamin C because you need acid in your intestine in order to absorb it. So that's what I say when you go and you look for a vitamin, you want one that's like all-inclusive vacation.
So how do you,
Does it,
sorry.
does it make you constipated?
The one that I have doesn't.
It doesn't?
It doesn't because it's getting right absorbed, and then we're also working on detox at the same time.
Gotcha.
Yeah, but if you're just taking iron and half of it is just sitting there because it's got nowhere to go, then it's going to kind of clump up and then it makes you constipated. Yeah, so it's all in the delivery, I think. Yeah.
So just to add to Liala's question, so if it's low iron or anemia, you need to also check that B12.
You need to check with B6, B9, B12, vitamin C. Yep, yeah. Because you need to make all the parts.
Or if it's strictly an iron issue.
Right, right. Yeah. So instead of just doing an iron level or just doing, usually when I do a functional analysis of blood work, I look for the CBC.
Right.
So I look at the hematocrit, the hemoglobin, I look at MCV, MCHC. So we look at the size, we look at the color. And based on those levels, we can tell whether this is more likely a B vitamin deficiency. Is this truly iron? We can look at iron. We can look at TIVC. We can look at ferritin levels. If you have an infection, your body is not dumb, and it's going to take the iron, because bugs love to eat iron, it's going to store it as ferritin. So your ferritin levels are going to go up, and you're going to be deficient, right? So if you go to the doctor and he gives you iron, is it going to help? No, because your body's just going to store it, and then you're going to have iron overload problems. So you really need to look at the whole picture, and you need to do these iron studies. If they just do a CBC and they say, oh, everything's fine, it's within normal, there's like, the range is this big, and you've been right here all along, and now all of a sudden you're right here, but you're not deficient yet. So do you have to wait until you're so weak that you can't get out of your chair and that the flags are going off before the doctor says, oh, maybe we should work on that? So that's what I do. So when you have blood work done, I do a functional analysis of it, and I look for optimum levels, and we try and catch things before you get into a red zone so that you can stay healthy. Yeah.
And you're identifying root causes.
And we look at the root causes. Why are you iron deficient? Is it your diet? Is it that you don't have enough B vitamins? Is it, so we try and find out. Other supplements, so adaptogens. Adaptogens are great for adrenal stress. They help to kind of mitigate stress. They sit there in the background. They don't bother anybody. But if you need help, they're like, I'm there, right? They're going to help you, and they're going to help you get through it. That's like your ashwagandha, your rhodiola, luthro, those kinds of things. For the gut, glutamine, probiotics, your cruciferous vegetables, your vitamins, your minerals. So if you have holes in the roof in your gut, right, you can patch some of them, but they're still going to leak. And that's when you get bloating after meals. That's when you get digestive upset. So that's your leaky gut. You get sensitive to a lot of foods. You don't feel good after you eat. So glutamine really helps to patch up all those holes and get the integrity of the gut back in balance. For inflammation, things like resveratrol, your fish oils, EPA is great for inflammation. DHA is great for brain. Turmeric and resveratrol work really well to break that pain cycle. So those two I partner a lot of the times. Detox, so glutathione is our best chelator. The body makes it, but because we are encountering so many toxins, we burn through it really fast. So supporting that with NAC, SAMe, B6, B9, folate helps us to keep that glutathione at the ready. We also use a lot of it in the brain. And vascular, so nitric balance, arterosil, annatto. Annatto is vitamin E's. So it's your tocotrienols. So there's E2s and E3s. The E3s they're finding really help with fatty liver. They help with inflammation. It's this little annatto plant, but really, really powerful. And then balancing the hormones. So doing that Dutch test, finding out which pathways are strong, which pathways are weak, whether you're detoxing right, and then we can kind of nudge the body gently with with nutrients instead of saying, oh, here's a birth control pill, or, you know, let's put you on hormone replacement, or here we're going to put some pellets in you. Let's try and nudge gently with food and see if we can put everything back in balance. And so adrenals, I went over these. So ashwagandha, L-theanine, GABA, rhodiola, eleuthero. 5-HTP is a precursor to serotonin, which is also very helpful. Phosphatidylserine is a phospholipid that's also very calming for the brain. Memory, things like ginkgo, ginseng, DHA, part of the fish oils, melatonin. They're using melatonin a lot in neurodegenerative conditions, and phosphatidylcholine, another phospholipid. For vasomotor symptoms, so your plant forms of estrogen, so wild yams, maca are helpful as pseudoestrogens. Also tribulus and black cohosh can be helpful for vasomotor, hot flashes, night sweats. Anxiety and sleep, kava tea, L-theanine, phosphatidylserine, GABA, and even doing some micronized oral progesterone. The metabolites of progesterone kind of help to shut the lights off. So it calms you and it will help you sleep better. So sometimes taking a little bit of progesterone before you go to bed. And then for libido, so wild yam, tribulus, yep, ovals. And so Beeswax is a great company. They make these ovals. The ovals have either estrogen alone, estrogen, progesterone, DHEA, and you insert them. So they're suppositories and you insert them, and they will help with the hormones. They'll tighten you right up. And then Tongkat Ali is a new herb. I don't know that much about it, but they're promoting it as a libido help.
So Doc, with the memory and sleep and several other things, I don't see any CBD up there. Is that worthwhile? Have products?
Yeah, I kind of left the CBD out. CBD is a tough one because CBD helps a lot of people with a lot of things, but it doesn't help everybody with everything. And it was kind of advertised as being able to help everybody with everything. So it's definitely worth a try. I would start very low dose and increase it based on what you need it for. And then certain people, if you're on certain medications, it can change the way you do your phase 1 detox. So if you're on certain medications, we really need to research that because I don't want to mess with anybody's drug metabolism. So yes, I think CBD is important. It's worth a try, but it's not for everybody all the time.
I've heard of tribulus. That was recent in someone's book. Dr. Marconi, I think.
Yeah, tribulus has been used for eons as an herbal libido booster.
Some of those things you can get through food, no? Some of them?
I don't know. I don't know what you'd have to eat to get tribulus. I can research it.
Wild yam, what kind of yam is it?
Wild yam, how would you describe it? Is there a wild yam? What kind of
Yes, it is a
fruit is
fruit.
that? It is its own fruit. It's not like a regular sweet potato.
Where do you get that from?
Ask the culinary nutritionist, putting her on the spot.
Well, the wild yam cream, it's a cream, it's topical. So in this case, when you're talking for hormones, it's a topical.
Yeah, I thought you were going to add it to your smoothies.
Yeah.
I have maca.
Yeah, maca's great.
Great.
Yeah, maca's wonderful.
I need just a little bit.
Yeah, Feminescence Pro is a really good brand of, they make maca.
It's more topical.
Yeah, you can also take tablets. Yeah, Standard Process makes wild yam tablets. Yeah, they make tablets, yeah. Yep. But there's good blends, like everything. They're like blending all this stuff together. We'll talk. And then exercise. So exercise helps with neurotransmitter production, so it helps your brain work faster. It helps your intestinal barrier, so it helps to plug up those leaky holes. Immune modulation, so it's going to help you stay well, but also helps you get well. Energy and muscle metabolism. It helps your muscles to recover quicker, and it helps to build energy. So using exercise, using energy helps you to build more energy. However, if you have iron deficiency anemia, oxygen is carried on a red blood cell. So if you don't have enough red blood cells, you don't have enough oxygen. So you may have no place exercising if you're really anemic because you just don't have enough oxygen. Your body's doing everything it can already to keep the basic functions. And so if you're going to go and you're going to do HIIT training 5 days a week and you don't have enough oxygen to begin with, you're going to feel more fatigued, you're going to be more sore, you're just not going to feel great. Your detox is going to be off. Yeah, you're not going to feel well. So it's important.
So it's important that you first get that.
Yeah, you got to look at physiology first. Yeah, so there's really a balance. You know, you want it, then maybe walking or stretching would be better than going to like a kickboxing class. So there's always something you can do, but you just don't want to do something over aggressive if you don't have the energy to do it.
So when you're exercising, you find yourself yawning a lot.
Mhm.
Is that like your
That's your body asking for oxygen. Yeah,
Amazing.
yep. Yeah, the body's not dumb. The more I get into this, the more I realize your body really does a lot of stuff.
But like when your body is, like when you exercise and it's not making you feel energized and well, and it's making you tired, your muscles, your joints are painful, you're in pain,
Yeah,
something's not right.
yeah,
You have to address something under that, right?
yeah. Either your ability to use oxygen in your muscles is off, or your ability to detox, because your body's like a factory too. So when you exercise, you're producing fumes, and you have to be able to kind of process that and detox it and get it out. So there's a lot to think about, which is why functional medicine, we kind of put it down on paper and we really examine all of it and we say, okay, maybe not now, but we'll do that in a little while, or we modify things. And then blood sugar balancing. So blood sugar balancing, when your blood sugars go up, your inflammation levels go up. So when they talk about cholesterol, it's not the cholesterol that gives you a heart attack. It's the cholesterol and the hardening of the arteries, and then you top it off with blood sugar and inflammation. That's the match that's going to light that heart attack. So you really have to, you don't worry too much about the cholesterol level, but you worry about your blood sugars and your insulin levels. And so that's, does anybody have any questions?
Well, I've heard Dr. Case speak often, but one of the things that I'm experiencing now is that I do have higher levels of cholesterol, and I was shocked. I'm still shocked, but I do understand that when you're in menopause, that happens.
Mm-hmm.
So the Dutch test is something I've been thinking about a lot. Can you just explain how it helps someone in menopause, the Dutch test?
With cholesterol levels?
No, in general, just.
Oh,
the
in
things that are
general.
happening, in menopause for me, for instance, lack of estrogen, libido, all that other fun stuff. How does the Dutch test, like, what will you look at in order to support?
So even in menopause, we're still going to look at progesterone, we're still going to look at estrogen, the levels are going to be lower. If you're exposed to, phytoestrogens, you may see estrogen on that test. We're also going to look at DHEA, we're going to look at testosterone, we're going to look at those breakdown products. We're going to be able to see whether you're methylating. So when you're breaking down those chemicals, we're going to see whether your liver is doing a good job eliminating them, or are they getting backed up. So we're going to look at ratios of E2 is your best, most healthy estrogen, E4 or E2, the O4, the 4OH pathway is going to produce more DNA damage, so we're going to see if maybe that's happening. We're going to look at your 16:2 ratios, which is going to tell us about whether there's a lot of carcinogenic genetics there. We're also going to look at your neurotransmitters. We're going to look at your cortisol levels, because whether you're in menopause or not, cortisol is cortisol, stress, and we're going to see, is it up all the time? Are you down all the time? Has your body finally said, forget it, you can be stressed all you want, but I'm not doing shit?
Yeah.
So that happens too. So that test is going to let us know what percentage of the time you have resting inactive cortisol versus active cortisol. It's going to look at melatonin, which is going to give us a clue of your serotonin levels, how well you're sleeping. So we still get a ton of information.
Even though I know my estrogen is like.
Yeah, there's going to be a level that's purple,
So how do you
and
get that back in?
by taking hormones.
Oh, no.
Yeah.
That's what
I mean, your wild yam.
Yeah, that's what I'm trying.
Yeah, so wild yam will help. We want it.
But bioidentical are better.
Bioidenticals are better. Yeah, if someone gave you a choice of, do you want to take this like equine synthetic estrogen, or do you want to take something that looks just like yours?
Yeah.
So it depends on your symptoms. You know, we always say, let's do things naturally, and I don't want to take pills. But at the end of the day, if you're having a lot of symptoms, you have brain fog, you have ApoE4, you have high risk for Alzheimer's, taking estrogen is going to calm your whole system down. And you just don't want to take, you want to do it carefully. You don't want to be a teenager again. You don't want to cycle. Yeah.
No, I don't want to cycle. That's
Right,
true.
right. So, you know, you have to, there's a delicate balance.
But certain aspects of being a teenager.
Thank you.
Yeah.
I agree.
Energy. And,
Yeah.
So what about homeopathic?
I'm not a homeopath,
Yeah.
but I know herbs have been used for thousands of years. Yeah, I mean, cannabis was on, you know, that was one treatment for over 8,000 years. So I think herbs, there's a big place for that. I think you have to do a lot of research, because herbs can help, but herbs can hurt. And you got to look at how they're prepared and how much you're taking.
Well, it'd have to be with someone who knows.
Yeah, yeah. So I do have a really good person if you want to do herbs. I can recommend her. Yeah. Anything else?
Is there, how quickly do you see results if you start kind of tweaking things a little bit?
If you start tweaking things with food, if you're doing an elimination diet, you can see results immediately. Depends on how severe you are. But typically when you do things from a food first perspective or supplement perspective, it takes longer. So I usually say 3 weeks for an elimination diet to really start to notice differences. 3 months to 6 months if you're going to try like herbal antibiotics or something like that. Like if you're going to treat Lyme with an herbal, then it's going to take longer. Yeah.
So question about the elimination diet. So is that you're eliminating, is it to eliminate waste, or is this to eliminate things out of your diet, like sugar and?
It's to eliminate mostly like gluten, dairy, soy, white foods, processed sugars. So there's a couple ways to approach that. One is I basically give you a list of foods to eat. You eat those foods, nothing else. And that really pulls out foods that have been shown in science to cause inflammation in the gut. Those are like the most common. Another thing that you can do is called a KBMO test, where it's a finger stick, and you put 5 drops of blood on a card and you mail it in. And then they take your blood, they spin it down, they put it in little tubes, and then they look at 176 foods all at the same time. So you get a list, and they can say, yep, tomatoes, carrots, green beans, walnuts, eggs. Like those are, you can't have those. So you pull those out. And usually you lose weight because all that inflammation weight, people usually see it in your face first. And then you just start to feel better. You have more energy. So there's really a couple ways to do that.
I've done it. It definitely, it helps so much.
Yeah.
Yeah. It just drills down on what doesn't work for your system,
Right,
you know?
right. And what you have a
And there's lot of
sensitivity to.
swaps, So you're not really restricting, right? When you think elimination, oh my God, I have to get rid of all these things.
Right.
It's just about learning how to swap things out of your diet and
Mhm.
with things that you can still have.
Right.
So, you know, it's scary when the word elimination happens or restriction happens. because
Right.
I think there's a lot of people don't understand or know that you can actually swap a lot of things to still feel good.
Right. There's a lot of different foods out there.
But I know
And-
when my daughter did that, I told you I did that.
Yeah.
But it was saying, that whole sheet was lit up, so it wasn't to me about her never being able to have spinach.
Right,
Or
Just
never,
taking it out.
right.
it was just about getting her to not be inflamed, so eliminating those things for a period to restore the gut.
Exactly.
So even that, from that perspective, if you have a leaky gut, anything that's leaking, it doesn't matter what you put in it, it's gonna keep leaking.
It just
So
keeps
you
pinging
need-
your immune system.
You need to restore the gut, and then some of those things won't be an offense
Right.
to your
Yeah,
body.
yeah.
you
It's
know?
like patching holes in the roof. If you have 30
Right.
holes in your roof and you patch 15 of them,
Yeah.
then you still have 15 holes in your roof.
Isn't it the 4 R's?
So-
Restore, re-inoculate,
There's remove,
remove,
restore,
restore,
replace,
replace,
reinoculate. Yeah,
yeah.
yeah. Yeah, but in her case, if you see someone's just blowing up the chart,
Yeah.
then you know she can't be sensitive to all the
This is
foods
what
all
I'm
at one
saying.
time.
Exactly. I'm like,
Yeah.
no way.
Yeah.
Look, it's just.
Yeah,
it's
so
like
something was
ridiculous.
going on. It was, she had the barrier, and it might
Yes.
have been too many antibiotics. It could have been,
You know what it was? I started to really think about this.
yeah.
When she was about 1 or 2, we had to go to the emergency room. She couldn't breathe.
Oh boy.
And she was almost intubated. And I know they were steroiding her and they were antibioticing her because that's all they knew to do, right? And because she couldn't breathe. So I remember him saying, oh, we might have to intubate her if she doesn't get her O2 stats. But they didn't know what was, they couldn't find like any particular infection, so they would just throw in at her little body.
And that
I
might have
know
been,
yeah, because then probably like a year later you start seeing the eczema, right? And
Yeah.
then her being a kid, like she was just
and that might have been what she needed. So there's your acute
correct.
stressor.
Yeah.
But at the same time, then when she's done with that, then you need to replace
Yes.
with probiotics so that the gut starts working again, a little bit of glutamine to help the gut to seal,
Yes.
even the lungs have their own microbiome, your mouth has a microbiome, your brain has a microbiome. They even looked in the brains of Alzheimer patients and they find oral bacteria in the brain. So that's why it's really important to brush your teeth. And if you're a C-section, you're not getting exposed to that vaginal bacteria, you're getting exposed to skin bacteria first. And so that is what's planting itself in your gut. So it's a little bit different.
Yeah.
Yeah, we know way more than we used to,
Yes.
Is that the
right?
similar with breastfeeding versus bottle?
Well, breastfeeding, because you get a lot of the mom's immune mediators, immune cells, and protection from breast milk. But a lot of us, if we're like in our 50s, breastfeeding was like frowned upon back then. There was this new thing called formula, and it was like, yeah, this is going to be the best new thing. So nobody knew what they didn't know.
Well, because then you don't have to like quit smoking and stuff,
Well, yeah, because you went to the gynecologist and shared a smoke with them,
2
right?
years ago.
Yeah.
Yeah, that was the thing.
Have a wine to celebrate. Yeah.
Hey, that formula came out great.
Yep. So, any more questions?